Hey everybody, it's Jessica DaMassa with WTF Health. What's the future health? We are talking to the who's who of health tech and healthcare innovation. And today we have the CEO of Crossover Health, the famed primary care provider for Amazon's employees. Please welcome Scott Shreve. Scott, it's a pleasure to have you here.
Hey Jess, great to see you again. Thanks for having us back on. Appreciate it.
All right, the reason I brought you here is to talk to me about the new funding. 168 million brings your total to 282, and I want to dive in on that. And then we'll get back to all things Amazon and IPOs
Sure.
and crazy primary care space. Holy cow, talk about a sector that's having like a moment this year. How about it?
Yeah, no doubt. It's an overnight success, 10 years in the making for all these people who've been out swinging the hammer in primary care for a long time. So it's a great moment, as you said.
All right. Well, tell me about that fundraise. So I know Deerfield Management led. You had a bunch of new investors in on this. So what's this going to be used for? Give us the inside scoop.
Yeah, so I think in the course of any company's growth, there's always the need for additional capital to make investments, to continue to grow fast, and to meet the market demands. And I think as everyone can see looking around, the market has really shifted, even the last 12 to 18 months, but certainly through the pandemic and so forth. And so I think you're seeing a ton of new opportunity, a ton of new entrants, a ton of competition. And we really felt it was the right time for us to, go raise money. It's a nice market check to see where we are as a company, how we're valued, as well as there's a ton of interest now that really wasn't there, a couple of years ago. And I think, all the effort and the years we put into building the model, getting to some level of scale, having some great opportunities with new partners, really set the stage for people to say, hey, here's a model we can invest in and we can participate in and throw our capital behind so that we can see it grow. And so this round was a little bit different. We historically have gone to venture capital or even private equity, but in this particular round of funding, we went to a new pool of investors, which we call, actually, interestingly enough, crossover investors. Oh. These are people that look at private companies, they look at public companies, they invest across a wider spectrum. And so it was great to go to that market. That was new for us, to go share our story, share our success, some of the growth, and some of our ambitions going forward. And again, we're really fortunate that resonated. The round was oversubscribed. We have 7 new investors coming into the company to really put their capital behind supporting this new model of health and really driving toward a vision of how we think healthcare should be.
All right. Well, I have to needle in here for just a second on that new pool of investors that are crossover investors, because people are going to be reading into that like crazy, myself included. So does this mean, is this a foreshadowing of things to come? Because, we're sitting right now in a very interesting time where, it's like of the competitors that you guys are often, thrown out there with, it's like 2 of them have raised a lot of money, but are still, venture backed. You've got Forward with 225 million. You've got Iora about 350 million. And then 2 others are like in the IPO space. So One Medical's already gone. They're worth between 5-6 billion market cap, depending on what day it is. And VillageMD just announced that they're going to go. So, what's the move here, Scott? Is that crossover group of investors like a little flag for us or what?
Yeah, it's interesting. So I think a lot of the early work done by, the One Medicals, the Oak Streets of the world to actually go public and to teach the market about these opportunities has been really helpful for those of us who are following. And so there was a lot of work to go back and to explain to people like how care delivery works, what kind of margins to expect, how you can project and predict revenue, what membership means, how these stores or these centers can fill up over time. So I think a lot of great work has been done, and that groundwork allows others to follow much more rapidly. I think also, given the success of those IPOs, there's a lot more investor appetite and interest, which happens to coincide with what's going on in the market. I think healthcare has been thrust to the forefront. I think COVID brought this to everyone's recognition. I also think that people recognize that healthcare really needed to adapt to this new world to catch up with other consumer areas and industries. And I really do think, as you say, it's just this moment where people are recognizing the value of primary care and all these different care delivery models. So we find ourselves right in the thick of that. We've been pursuing a specific model, as you know, kind of off the fee-for-service grid. We have gone directly to the employer market, and we found a sweet spot to work where employers are really looking to drive to value. They're really looking to look at value-based healthcare. They're looking more at different forms of risk. And we find ourselves in a really nice position where our solution is mapping to the needs of this set of employers. And Jess, I think we'll dive into this, but what I'm excited about is that it's not just the employers that are looking at this, right? So the payers are also looking at what about these different primary care models? And they've seen a lot of success in the Medicare Advantage space. And now they're looking, hey, can I apply those concepts to my commercial populations? And this is where the whole idea of commercial advantage comes from, which I'm sure we'll dive into. But I do think there's several cross, wins that are kind of, filling up the sails and giving a lot of people a lot of opportunity to look and to invest in and test different models of care. And so we're going to be looking at all the options going forward in terms of where we receive additional capital to grow faster and to grow bigger and to have more impact. Will that be private? Will that be public? I think we're in a position where we'll have some optionality, which we really like. So.
All right, that sounds good. I'll let you keep it there. Although I have to say that you're on a lot of people's if there was one of those like NCAA tournament brackets, if there was a bracket of public, you guys are on everybody's bracket in the Final Four. I'm pretty sure about that. At least for
we'll take it. We appreciate that. Yeah.
You're on the short list, but we'll let it go. We'll let you stay there, and that was beautifully answered. And so you gave me a lot of other things to jump in on, and I'm not going to disappoint. We are going to go into all of those things. I want to start out though, because of the fact that I just want to make sure everybody is up to speed on your model and how you're differentiated before we continue to talk about competitors and before we continue to dive into your movement into the health plan market. Why don't you tell everybody about your model, because it is very differentiated. Sure. In this space. You guys have built something, for a long period of time that is quite different. And so I want to hear about the model, and then we'll get into all the other stuff with the big names like Amazon, and we'll talk more about competitors and things like that.
That sounds great. So let me set up the little 4-box or whatever's helpful for people to think through. But on one side of the spectrum, you have more of the traditional market, fee for service. We kind of know how that's played out. And you see some innovators in that space. One Medical kind of fits in that area, where they've added a membership to that. You might consider maybe Forward or some of the other concierge practices. That is a model where we're reinventing what primary care is and how it works and the experience of it. On the other side, you have other models which are much more risk-based. They're capitated models, different forms of that. And that's typically where the Medicare Advantage players play. And so I think that's also been fairly well understood, and over the last 10 years has had a lot of growth and a lot of success. And now we have some public examples of that from Oak Street, and then some privates like Iora, Devoted, ChenMed, many others who have been very successful. And so between those two kind of ends of the spectrum, crossover sits in the middle. And the reason we say that is we're off the fee-for-service kind of treadmill, and we're not fully capitated either. But we are in value-based arrangements where it's expected that we actually manage costs, we deliver to certain quality expectations, and of course the experience remains exceptional. And so in that zone, we kind of find ourselves uniquely working historically with self-insured employers. And so they pay us to offer a set of services, which we've described as primary health. So it's not just primary care, a doctor and a nurse, but now it includes mental health, physical medicine, health coaching, and care navigation, all part of one single care team that's providing care to designated populations. And that's how we can get to the accountability. When you interact with crossover, you're not just getting a random doctor who happens to be available for that urgent care condition you need. You are actually accessing your care team who knows you and is going to manage your condition over time. And I think that's really important because that's how you actually get to accountability. There are certainly situations where getting an urgent answer to a question is important, but we find that the most value is created when there's these relationships over time. And that's where we've always bet our model. This integrated, coordinated, comprehensive care teams assigned to specific populations, driving towards specific outcomes is where we've really kind of landed in a sweet spot there.
Okay. And now,
so let me just make one more color to that, which is
color it for me.
Yeah, given that model, we're off fee for service, right? So that's different. We're accountable. It's a comprehensive model. And now, we can deliver this pretty much everywhere, right? So through our in-person, online, anytime model, it gives us a lot of flexibility to serve the needs of employers who find themselves in all kinds of different configurations. Yeah. Sometimes there's a big headquarters. Half the time, they're spread across 40 states, and they're trying to figure out how to deliver care. And so again, this particular model has the flexibility to serve the needs of people who are in Silicon Valley versus those who are in warehouses in the Midwest. And what we find is it's the same actual chassis, but we might switch up and the service mix might be a little different depending upon the needs of the population we serve. But I think that flexibility of the model to serve both of those kind of different needs and with the same kind of operational model is very effective. That's where we found a lot of scale, a lot of efficiencies in terms of a financial model as well.
Okay. I want to talk about Amazon real quick right here because this is, I think, the thing that you guys are best known for. And, you know, how are things going with them? And in particular, I'm curious because as you had mentioned, you know, in-person care, but also virtual care. Any concerns about the new Amazon Cares virtual telehealth network that they're building over there? Are you guys involved in that in any way?
Yeah, so great question. So we get asked all the time about this, and Amazon is on the extreme sides in terms of how large of a client they are. And I think from the outside, trying to understand what different companies are doing is always very challenging and interesting. So Amazon, as you know, is a massive company. The Amazon Benefit Group has worked the last several years on some innovations around virtual care, home delivery, pharmacy, and some other things. And that's, you know, where Amazon Care has really put a stake in the ground. And I think that's matured enough where they want to see if there's a market for that outside. The group that we actually work with is primarily the operations group, which is in charge of the warehouses, the logistics centers, and so forth. And so that's about an 800,000 person operation. And our project, which people that you're referencing, was to go and to implement our services in 5 markets. And I really like the approach that Amazon took. And I think this is very representative of what I think other large employers will do. What they did, and we'll pick one market, let's go to Dallas, right? So Dallas is a large market for Amazon, about 50,000 employees. And what they did is they looked and said, okay, well, where are all these employees? Where do they live? And we could see kind of different hotspots where they live. And so what the solution was there was to surround the entire population with our virtual care model. So anyone, anytime can access the virtual care team. But we also, because we could see where people live, we went into their neighborhoods and we built what we called neighborhood health centers. And these neighborhood health centers effectively function as nodes on the network, right? You have this virtual network that surrounds everyone, but then there's physical access points where people can actually go get care in person. And so what's great about that is it's actually the same care teams delivering both the service, whether it's in person or online. They get to know them. They build a relationship. The access points are important because, as everyone knows, you can't quite do everything online. So being able to have this hybrid approach is really impactful. A couple other interesting things we did for Amazon. So again, we built these in the neighborhoods where people live because this service is actually open to the dependents as well. And as part of that, we actually enhanced our services by offering pediatrics as well. And then we extended the hours that these places were open. So we're typically open from 7 to 11 at night. And what that does is it allows us to catch all the shifts of the different people. And then, of course, we have 24/7 care if we fall outside those hours. But I really appreciated Amazon's approach to widen the spectrum of the people, of the set of services that were offered, the times that those services were offered, to surround everyone virtual, to make it accessible in the neighborhoods that they live. And I think you're going to see a lot more of this model. Now, one other interesting thing, Jess, I think your listeners will find interesting, is because of the nature of that approach and because we start with virtual first, the nature of the physical centers actually changes. Okay. Because now I'm starting a lot of care online. Now my centers can be much more focused. And we call them confirmatory centers because you're only now coming in to confirm something, whether that's a blood draw or vaccine, or I need to lay hands on you to actually diagnose something properly. It becomes much more of a focused center. And so our staffing can modify, the size and the footprint can modify. And I just think that's a really interesting thing of thinking about the architecture of your solution. It really changes as the mix of what you're delivering changes. And I think that's something, a model that we're going to see a lot more of, these smaller confirmatory centers complementing the virtual access to everyone.
I love that. Get rid of the waiting room, Scott. I need that.
Never a waiting room. We've never had a waiting room at Crossover, and because no one waits, right? 95% of the time you're back in 5 minutes. So that's exactly the way we like it.
I love that. All right. Okay, let's move on from Amazon, because here's the thing. I keep hearing, do they have any other business beyond Amazon? So Scott, do you have any other business beyond Amazon? Because I feel like Crossover has been so linked. And I mean, and truly, actually, to hear you talk about it, all joking aside, it sounds like you've learned a lot from working with them as well, which is great. That's fantastic.
Oh, sure. Yeah.
But name drop some other clients for us. Tell us who else you're working with.
Yeah. Yeah, I love I mean, every once in a while we hear things like this as well, and we think it's great. Obviously, people are coming into the story at different times, but we're going on a 10-year relationship with Apple and almost a 10-year relationship with Facebook, and then of course Microsoft, and of course Comcast, and LinkedIn, and all these other great companies that are finding our models. It's interesting. What this kind of speaks to too is like, hey, well, how concentrated is your business with these different employers? And this is something we've dealt with our entire existence, because our first client, as you know, was Apple, and they were all of our business. And then our next client was Facebook, and then they were a large part of our business. And so every client that we add allows us to diversify away and have a much broader client base. Fortunately or unfortunately, because the clients we win are so big, there's always the new and next concentration issue. So again, this is something we're aware of. If you don't consider Apple, Facebook, Microsoft, Comcast and others as large clients, and that's, so Amazon just represents a fraction of our business. It's actually large and it's growing. But I think it's a fair criticism of these models, because they have to have reach. Not everyone is in Amazon and Facebook. And what we're really looking to do is to spread this model so that more and more people can access this. And so that was the whole reason to go to near sites, where smaller employers can get the same benefit as these big employers. I think as we go into a market and we build a network of these confirmatory centers, it just creates more access points and more value to anyone who's on the network. And I think that's really a powerful concept, because the crossover network, and part of the reason for the funding, is we're just going to grow the value of the network by adding more and more physical locations throughout the country. And so anyone who's a member of Crossover can actually see and stop and join some of these centers. Now, to be clear, the Amazon centers that they're building right now are private and unique to Amazon. But as we go into each of these markets, we're adding more and more physical locations to complement our virtual services. So we're very excited to see how that expands as we go forward.
So Scott, are they the only one who have their own private, or are you guys in a hybrid there as well, where some of your clients have their own private confirmatory centers, or are the rest, are they the outlier only?
Yeah, so if you think about our business, we started as an on-site. So those were private for every single client. We went and built something great on their campus. Near site allowed us to actually go into the communities where multiple employers in a geography would join. And then, of course, virtual really now opens this up.
Yep.
So I would say it's about half and half of our business. So about half of it is kind of what I would say kind of custom, large-scale physical centers. And then about half the business is more of the standardized near-site / virtual offering, where people are coming in and joining Crossover for a more scalable solution. It's obviously priced differently based on the nature of the services. But I think you'll see more and more of that as we go forward. You'll have this ongoing mix of kind of custom build-outs for very specific and perhaps large clients. And then you'll have smaller clients join more of the standardized. It's more efficient. It's more cost-effective. And so I think that dynamic is going to really play well in the market, because people are at all different spectrums of what they need and what they're looking to do.
I want to dive into this a little bit here, because I think that this is really interesting. So when I spoke to you last, which was like almost a year ago, like at the beginning of the pandemic, we spoke, and it was like the announcement of the Amazon deal, that whole thing. But, one of the things that you had said to me, which I've used so many times, so thank you for this, was the term health activist employers, which I just love. And I still love it. And so I'm curious to hear how you think maybe the definition of a health activist employer has kind of evolved, and now kind of looping in some of these smaller employers that are, either full risk or insured themselves, or however they're managing their own employee population, their own employee plan. So like just recently I spoke with the team over there at Firefly Health about their offering, which is specifically targeted to the 50 to 500 employees kind of business, and wrapping a health plan benefit around it. So it's like a one-stop shop deal. And I'm curious to hear, like, from your perspective, because it sounds like you're kind of headed that way too, where it's like maybe this era of whale hunting, these large self-insured employers, drawing to a close, and people are looking at how they can extend what they've built out for these large self-insured employers, how they've proved the model out there, and have it trickle into more of these mid-sized small employers. Like, what's your take on that? I'd love to hear you talk about it.
Yeah, I think, first of all, it's a great question. So like many things, the way I describe what you're talking about is more of the long tail, right? Is that when you add technology to the mix and some of these newer models, you can actually start to address the needs of the more unique or smaller or individual members all the way down this long tail, right? So, kind of like, it's a little bit like Elon Musk, and Tesla. That's a highly referenced example, but they didn't start with the Model 3, right? They had to start with the Roadster, these big, unique, high price, but in doing that, they were able to prove out a lot of things about the model. They learned how to produce things and scale things and so forth. And then they kind of moved to the Model S, and then now they want to move to the Model 3 and the Model Y, right? So I think you're seeing that in healthcare finally, right? So a lot of these kind of big iron, big custom on-sites have now moved to a much more of a standardized near site. And I think what you're seeing now is virtual gets you to the next level, because, it wasn't historically efficient for us to serve 50 employees.
Yeah.
But now we can do it because I already have my virtual utility that's already set up, and it's ready for patients today anywhere in the country. I've already had to make the investment. So to add an incremental 50 lives is totally different than it was 2 years ago for me. And now that's a possibility. And I think groups like Firefly and so forth and others like them, they recognize this, that you're going to start to be able to serve the needs of these smaller populations. One of the things specifically about that, Jonathan and I have talked extensively about this in the past, is that how great would it be to actually wrap the benefit around the care model, right? The care model and the payment model are combining together now. And that's actually really powerful. That is, in our view, we call that commercial advantage, but you could also consider that as a retail membership, right? Someone who's paying directly for the care who actually gets this, yep, versus now your employer is offering a plan, and crossover, sits at the base of that plan. We're your medical group. And when you join that plan, you're getting a lower copay and a lower premium, because the way the model works is most of it starts online. It's much more efficient, more cost effective. And then, of course, when you need care, you actually have to physically get access somewhere. And so this is an interesting story, Jess. So crossover, we have about 1,000 employees, and so we're self-insured,
okay,
right? We eat our own dog food. We offer crossover to our own employees. And what we did this year, which was unique, is we changed our benefit plan to map to the care model. So people who join what we call XO First is the name of the plan within our own company. If you join that, your premium is less per month, and your copay is actually zero if our care navigators refer you.
Okay.
And that's really important, because 85% of the spending is actually in secondary care. It's outside of primary care. So as a CEO, crossover, sit down and look at our healthcare spending, man, if I can inflect 85% of that care by how I direct and steer people, but do it in a concierge way that's actually useful to the member through our care navigators, you can actually drive down that cost. And so we're experimenting with this ourselves, and I think we represent one of those smaller companies that can now use a service like this to get to some of these advantages that historically, only the big guys have been able to get.
All right, so I'm going to ask you next. Are you going to wrap a benefit around this and make that available, or is that what that commercial advantage is?
Yeah, so commercial advantage is actually that. It's tying the payment model to the care model. In the case of the employers that we're selling and the payers that we're working with, what they're looking to do is exactly what I just said. They're going to create a plan. Crossover is the medical group at the foundation of that plan. We'll get into people's we do all the health queries and the screenings and the prevention work. And then, of course, we're there for the care 24/7. And then we provide the steerage if they need to go out into the secondary care network. And so we're going to be piloting our first commercial advantage plan this summer. The enrollment period is already live, and we're getting people to enroll in that, and it actually starts July 1st.
And
we're thrilled about this.
Can you say? Who are you working with?
We haven't made it public yet, but it's
Scott,
a well-known insurance company.
Now is the time, buddy.
Well, actually, we'll come back on the show. How's that when it's ready to go? Yeah. But it's everyone knows who these guys are. That's right. They're a well-known insurance company, but I think it represents that first move where people are starting to really experiment with this idea of putting the payment model with the care model. The one thing that's not understood always in those things is that you also have to have an engagement model. People don't just come and show up, right? I mean, you've got to get them enrolled and engaged in their health. And that's actually where a lot of the secret sauce of crossover is starting to emerge, is how we were so good at engaging people when it was a physical center and you come in, you meet the provider, you see that it's a totally different space, and that was very easy. But now when most of the introduction and the first experience with crossover is virtual, we have to get really good at the digital engagement. And so we think when you marry the engagement model with the care model, with the payment model, that really starts to become this thing that, we'd love to make that available to everyone. We're starting with employers, we're starting with payers, and hopefully we'd like to make that available to everyone in the future.
Oh, Scott, you just cruised further into the bracket with that statement, I think. Everybody over there is probably freaking out right now. You're gonna need to be well capitalized for this,
Yeah.
Yeah.
Yeah. No, I mean, here's what I'll say about that is that everyone here, we're entering this period. I'm going to call it the Great Consolidation. I need to write a blog post about this, but
please,
the era of a standalone point solution surviving in this era where people are, like our employers' clients, as an example, they have, 15 to 20 different point solutions in their ecosystem, which means 15 contracts, 15 renewals, 15 marketing plans, 15 efforts to engage their members. It creates a lot of chaos. And so what I think you're going to see is more people kind of joining capabilities, more people bringing things together, and really getting to where you have fewer confusing different things, or at least that they'll be integrated in a way that's much more useful and user-friendly. One of the things we can say about that, and part of the reason where we'll be spending some of the capital that we just raised, is to help organize that ecosystem in a better way. We happen to think, and of course we're biased, that the medical group is a great organizer of the different health benefits that people can get. And, could we be prescribing some of these point solutions as part of the routine part of our care? And I think in that model, it's great for us because it's another way to extend our care. It's more data that we get to collect. It's more engagement. We become a force multiplier for the employer. And it seems to put it in the right framework where when people are taking 95% of my recommendations, I can now get the usage and the impact that we all have hoped for a lot of these tools. So we're excited to see where that goes. And we do think the medical group is a great mechanism to organize the ecosystem in a way that maybe hasn't been done before.
All right, well, we'll look for that. That sounds very exciting. Don't leave us digital health folks behind, please. I know that they would love to be. Those point solutions are just begging to be put into yet another formulary and prescribed, like we know it. But yeah, this equation of primary care plus navigation plus benefits plus centers of excellence seems to be an equation I keep hearing a lot about. And so we will definitely keep our eyes on you guys and see how it goes. Scott, thank you so much for joining us and for waxing philosophical on the future of primary care here and all of its different eras. I love this, the era of consolidation, folks. That's the soundbite you're leaving me with this time. Last time, health activist employer. This time, era of consolidation. I love it. And we'll keep our eye on.
Always got to drop a tidbit for you, Jess.
Hey, I appreciate that. I appreciate that. And I love hearing about all of this, all the crossing over here at Crossover. It's like the and both payment model that you guys are running, the virtual and in-person clinic, the crossover investors. I mean, we'll just see where it all goes. Scott, thank you so much.
Thank you, Jess. We'll see you.
All right, guys, if you want to check out more interviews with thought leaders like Scott Shreve over here, the CEO of Crossover Health, please check out my YouTube channel. You can learn more about that equation I dropped on YouTube. There's a lot of folks talking about that, I promise. Just head on over to youtube.com/WTF Health and you will find all of that there. Scott, thanks again. I'm Jessica DaMassa. We'll talk to you guys soon. Thank you so much for joining us.